Greetings. Welcome to another episode of Caring for You with me, Dr. Terence Drew. Today I want to speak about heat exhaustion. We see that the weather is very, very hot here in St. Kitts and Nevis and throughout the Caribbean. And a number of patients have been visiting my office with symptoms that are very suggestive of heat injury of varying severity. So what causes heat injury or heat exhaustion? This occurs when the body temperature goes very high as a result of increase in environmental temperature or very high temperature with respect to the weather condition. And what can this lead to? If you are exposed to the heat, this can lead to dehydration, and with that you can have weakness, lethargy, which means lack of energy. You can have headaches. It can really affect your performance, and it can also lead to, in some people, confusion, and some people can even go on to have coma. Some might refer excessive sweating. When they go to the bathroom to urinate, they might recognize that there's a decreased volume of urine, and the color of the urine might even be changed. And so this must be taken very seriously. Who are those who are most vulnerable? Most vulnerable are those who have underlying health conditions, who have heart disease, kidney disease, or any type of other systemic chronic disease. Those who are elderly in our population, they're more vulnerable. Children and those who work out in the field who are exposed to this high temperature. And so we must be very careful. What measures can we take really to protect ourselves and our family and our community? First of all, we'll say make sure that you drink enough water. The water doesn't have to be ice cold but chilled, so that it can help to bring down the body's temperature. You can also have a cool room with air conditioning, where you can have those who are most vulnerable can go and cool off. You can use rags or towels that you would immerse in water, and you can use it, cool water that you can put around your neck, and that will help to control the temperature. The fan can help to some extent, but if it is very hot, you know that it will blow a lot of hot air. But it is important that you try to keep yourself cool with these very simple measures, and try to avoid the outdoors. And if you wear the clothing, should be light clothing that wouldn't trap heat and therefore would not lead to an increase in body temperature above what we consider to be normal. And so with these simple measures, we can help to prevent heat exhaustion or even heat stroke. Heat stroke is much severe. That is when the patient can have seizures and confusion and loss of consciousness, and we can see that in some elderly patients. I've had one or two elderly patients who would have fainted and had to be admitted to the hospital as a result of heat exhaustion. And so with these measures, you can really make a big difference. And I want to thank you for listening to this episode of Caring for You with me, Dr. Terence Drew.